Hello friends and colleagues, my talk on telemedicine, Boon or Bane, slated for 21st February, was having little jamming because of the data connection and everything, and today is 9th March. So I do appreciate Dr Mohan RAO Gari and Dr Sasi for the stewardship for the body through these times, and especially appreciate Sasi's dynamism and keenness to include this topic in the sessions as it is. And let me start. In around 2000, we had a conference, state conference in Vizag, where in the Hotel Decibella, some of the members will recall it very well. So we had a regular conference as well as an OT, hotel room made into OT, and it was live broadcast into the conference hall, and there was a question answer session. That truly was almost ahead of times, or rather it brought the times into practice. So full appreciation to Dr Mohan RAO Gari. During that time he was holding everyone for the conference. So that in a way showed the way towards the IT, and now we are in digital. So going ahead to the backdrop of this topic, so in one way I will say that this is me and IT to we in digital. So in 2002, when I started academic research institution center, and our dermatology colleagues have also come for that opening ceremony, where I placed the Dabba size wall computer in the small clinic sections that I put up along with the lab and pharmacy, of course. So I was even at that, after the Despella conference, I was proposing that we acquire a computer, the logistics of a computer, perhaps a staff, recruiting, training members were all there. But anyhow, from there, now we are into a stage where it is we and digital. Every one of us, not just we, the public, members, regulators, everybody has a smartphone, a digital tool in their hands. So my view about whether telemedicine, is it a boon or bane, I would say it is both and more. We will come to that in a short while. Then the issue is what to do and how to go about it. So I will just share the slide now, and then we'll touch upon this again. So I'm doing this session also recording and sharing in the YouTube and with the private viewing for our members. This also is part of the digital. And so what to do in case of boon? We have to increase, and what to do regarding banes? We have to reduce, and most importantly, like stock markets, up and down, there is another movement called transition, horizontal movement. Along with the boon and bane, there is something called the change. So we have to manage the change. So how to go about this? The two twin mantra for doing this is, one is standardize our operations and customize them. So we'll visit this slide towards the end of this sharing, and I'm trying to keep it under 15 minutes. We'll quickly run through a few themes. So what's the law? Where does the law stand? Sometimes we heard earlier that WhatsApp message by doctor is reprimanded by court, and it is quoted in media in an adverse way and all. So where do we stand? In 2020, in the corona times, right on the day when the lockdown one started, that is March 25, central government also has cleared clearances for the telemedicine. So before that it was help in goodwill, sometimes going sore. From March 25th onwards, it was legally allowed. And July 15th, I declared entering into telemedicine, and 18th, I started telemedicine operations using the existing social media platforms and WhatsApp and all, integrating them. I'll come to my part, my foray and experiences a bit later in a short while. So what's happening in the telemedicine, digital and all these issues? We had practice fiasco where Practo was giving consultation assistance and kind of thing, generating more concepts, and also without taking doctors on board or views and everything, it started adding ratings. Like in hotels, we go, we choose, or restaurants, we choose the ratings, star ratings, and then prefer. It directly started giving ratings. It is enabled customers to give, clients to give ratings to the doctors without taking the professionals on board. It created so much, you all know. Then, along with the COVID and all, Zoom flood has happened, and digital overwhelmed rather than empowered at times. And then WhatsApp tsunami, all of you must have had so many pictures with requests and suggestions coming. Then Skype Sandadi, so it had, it come, it goes, kind of things. And app wars, many apps coming, integrated, built in, individual, solo, selected. So it's all not integrated. It is promising but not integrated. I'm sure many of you might have been approached by different companies, IT companies, trying to partner with to develop programs. And FB sessions, of course. In lockdown 1 onwards, I've had almost a running FB live sessions. That's the first time for me into social media live broadcast, and it continued on many themes. I think that many of the members can very well use the FB live sessions to get into that mode, but of course it's up to individual choice. Then the other point is about point number 6. I've made around 13 points. The next, let's look at issues. What are all the issues in and around the telemedicine and related? So it's the patient, attendant, and colleagues, and trans-departmental, other departments, and then public, regulators, and other media, patient groups, and perhaps medical organizations. For the patient, it is the first consultation can be digital, or consultation has happened, and because they are from different place or anything, now the social media, all these are allowed and everything. The review may be on the tele, whichever platform as it is, and every person has got certain dynamics. Attendant dynamics are one group, and regulator frameworks, all these having been documented again, backup for any case of any angry client or litigation or later downtime. So what standards, procedures we have, those are all the issues related to telemedicine, and properly addressed, most boons can be multiplied, banes can be improvised, transition we need to manage. The various other issues are there which were always on the burning side and smoldering side, but which get more traction with the arrival of digital, telemedicine, ease of communication to simplifying of communication. There is a saying called things should be made simple, but not so simple that they lose sense. So the other issues, which actually, in my view, they are the drivers of the telemedicine revolution, will be a system of second opinion. I am strongly in favor of second opinion or even third opinion. We need to have a standard operations. Just today, there was a person from Kakinada made a call because his nephew was in US, who was my student, whichever now professional colleague. So he had confidence in me. He referred. So the Rajahmundry person's son was already taking treatment with our professional in Rajahmundry, and he contacted me. Showed me the prescription regarding the vitiligo, segmental vitiligo, little stretching on. I marked my writing with as second opinion and endorsed what's happening, and I added certain things so that those can be shown to the consultant. So whether me showing or not, otherwise second opinion is a strong requirement. There need not be any sensitivity regarding it, but there is a way to go about it. The disease itself can vary, evolve, drug changes, evolution, so many things can happen. All those can be put as disclaimers. I'll try to share a second opinion letter format, but this is going to be a strong one, because the person is somewhere else, uncle is in some other city, some other nation. They just want to have, sir, is it true? Doctor, is it okay? So those kind of things will be, because digital makes accessible fast. Any small doubt, people don't want to refine their doubt and kind of thing, but immediately they either want to ask their Dr. Google or cross-check with another doctor. So in follow-up sessions, these are very solvable issues in the digital, provided once the doctor-patient relation establishes and some follow-up sessions can be done, which will save a lot of exchequer to patient. They will cut down the inconvenience to attendant. All of this will create, depending on the result accumulated, progressing the result, tremendous goodwill will develop amongst the public towards the allopathic system as it is. And the other issues will be non-practicing government doctors not allowed to practice. If it is so, are the government doctors allowed to practice digitally, at least in other times? That we need to see. And this is going to be a tricky area, I suppose. And for all other members who are there in the private hospitals as full-time consultants, of course the hospitals are also encouraging members to go for camps, but can they have digital practice? If so, will the patient from the hospital be directed to a private clinic, individual digital platform, routed? So these are the kind of work ethic issues that will come up, and developing a policy, the hospital policy or doctor policy, then sharing will be required. I'm touching upon the various themes, some of the themes that I feel will be of relevance and immediacy to the attention of the members also. PGs particularly can also look at this, because digital is going to be a huge part of their day-to-day practice even before they leave the campus. And camps and camping, there is not just the patient and attendant, but the camping place, the manpower, infrastructure, people who are arranging travel, logistics, all these people, this all can be communications wise standardized and much more improvised. So camps and camping, all these things, people who camp will go again after maybe a month, maybe after a week, maybe one camp and back. There's a lot of interest to get a follow-up, how to go about. Various NGOs enter into camping circuit and everything. Perhaps a camp with a follow-up, digital follow-up, will be a successful model covering the logistics problems of the yesteryears. So academics and the digital publications, I'm sure that the NIADEVL can think of its own publication with its own standards. Perhaps will offer other members a model to come about in the digital platforms. I'm sure Shashi, you can count on me for the frameworks kind of things. And then research, because of the visual science documentation and the dated timing and everything, I suppose some of the research components can be there. And between institutions, integrative works, not just between departments, but between campuses and maybe perhaps between continents. Also, some of the joint works, discussions, academics, they can be done now. It was very difficult. If we send an article to a journal at that time, 2000 conference time, so it takes 3 weeks for the letter to go there. Then they see, and then if they send by return courier, if we attach stamps at that time. So all this will take about 2-3 months time to know if it is accepted, if it is not accepted, for what are the reasons. Now that happens overnight. Perhaps because of the load, the editorial staff of the journals is loaded. So those are the kind of things, joint works and with other departments, IT and all. So I'm into the last 2 minutes. Boon, Bane, transition. Boon, increase in revenue, increase in name, fame, more visibility, recognition, these are all there. But who requires what is to be identified clearly, and then we need to go about. And then Bane, time mix-up, odd times, calls and everything are common, but here video calls and so many things can happen. And communication mix-up, you are in one call and then missend, typos, errors, to send to somebody going to Jana tha Japan, pahunch gaye Chin. So, samajh gaye. So those are the issues. And then all the headaches of work from home issues, mix-up, those are the things we need to manage. More importantly, I believe that the transition is to be managed well. It's not about not taking steps towards the telemedicine integrating, but it's about taking those baby steps. Who will take which baby step? The process can be baby steps, then review, then either the classic principle, do more or do different, and then get going. Then we need to have standardize our standard of operations. Just like clinics will have different standards and different issues, and then infrastructure, cleaning, staff, security, different clinics will have different standards. Similarly, digital presence also, people can have different standards, timings, operations, communications, availability, by appointment or not. And then customize. Not everybody, telemedicine need not be for everybody, or all of telemedicine need not be for everybody. One can customize their services, either information services, follow-up. I think this 15-minute is reaching. I'll end this video here, and the small balance I will make another small brief video. Thank you all for watching this.